We're going to move on now to talk about how the prescription drug event data, where the source is and how it gets processed to show up as a research file for us. So we'll talk a little bit about what is an event versus a claim. I come from having studied claims before the Part D data was available, so that was very much the space I was in, and that might be true of you as well. So what do we mean when we say prescription drug event? We'll talk a little bit about how the data are processed, and then what data system CMS maintains for all of the event data, and then what are the sources of data for the event files. So, when we're talking about claims, in general, we're talking about a bill that's submitted for payment. And when we're talking about the fee-for-service Medicare system, the bill gets submitted to Medicare. Medicare, decides, is this covered? Is this not covered? How much are we going to pay? And then they return. We get the information about what they've decided, and we get to see that transaction. And then the providers are reimbursed per claim by Medicare for the service that was billed. And this is kind of what that looks like. Someone goes to a provider for treatment, they make the claim. There are MACs that decide or that help Medicare with entering the claims, ensuring consistency. That will get sent to Medicare, the Medicare program, once decisions are made, and it kind of goes in this circle where there's payment. There might need to be some adjudication in between where there's some talk about how much is going to get paid, but it's all, we kind of get to see it all. In the fee-for-service system, we get final action claims, but we do get some information about things that happen to the claim. Now, when we're talking about events, now it's a description of something that happened rather than the direct observation. We don't see kind of how the claim was submitted and how it was paid. We get, did a transaction happen between the pharmacy and the plan? And in this case, a transaction, it would be something that actually, like if it was a claim that was submitted and the plan said, we're not going to pay that, then it's not a full transaction. We wouldn't see an event for that. But if a claim was submitted and there was some adjustment, what we get is the description of the final adjustment between the plan and the pharmacy. And we get to see, if a claim was sent to the wrong plan, we get to see that the plan ends up getting, the proper plan ends up getting billed. And then, if there's a plan to CMS adjustment in demonstration projects, there's that information in an event as well. Plans have up to 6 months to submit event records to CMS. So they generally, figure everything out, and then they will submit the final event to CMS. So in this case, we have someone that received a prescription, probably from a healthcare provider, and they take that prescription to the pharmacy, or they're mailing it in, or it gets sent to the pharmacy by their provider somehow. And then what happens at the desk of the pharmacy is really what we're visualizing in the Part D event data. So the pharmacy will submit a claim. They use an NC-PDP form to their Part D plan. And there will be, something that happens in between the pharmacy and the plan to decide how this is going to be paid. And then the plan, once everything is figured out, will submit through the prescription drug front-end system into the drug data processing system. And then eventually it gets into the integrated data repository at CMS. And then it will go to CCW, and they will create the Part D event file for researchers, the research identifiable file. And if you want more information about the drug data processing system, there is a link on this page. It should be on the slide PDF on our website, but we can also get that to you if you need it. And so when the chronic conditions warehouse receives it, they create the file for us based on the monthly files that they get from CMS. They also will add some derived variables, and they will encrypt variables as necessary. So when they're creating the research identifiable files, they'll look a little different than even what the plan had originally sent to CMS. And then they create an encrypted Part D event ID. And that is a unique identifier for each record in the PDE file. And you can use that to link to some of the various characteristics files that we'll talk more about those later on in this workshop that are available. They are information that will supplement the PDE, and it will be something like a pharmacy characteristic or a prescriber characteristic file. And depending on when you've ordered your data, some of these identifiers for prescribers might be encrypted, and we'll talk about that as we go. Most of them now are not, but so when CCW is processing, they add information on the drug characteristics. So the PDE, when they receive it originally, will just have an NDC code, or in Part D, it's referred to as the product service ID. And it's just that code, which if you're just glancing at all of these long codes, they're 11 digits. It's hard to know what's what. So they link to a proprietary database, and they will add the brand and generic name variables. So you can see on the PDE, if you request those drug characteristics, you can see what those are. They also calculate a benefit phase variable that directly links to what Nate was talking about, how beneficiaries, as they go throughout their year and they spend various amounts on their medications, they will enter different phases. There's that first deductible phase. There's the initial coverage limit phase, the coverage gap that's phased out, it's being phased out, and the catastrophic phase. So CCW adds that variable. Gia will be talking about that later, but that's something that is derived by CCW for us. And then they also add those linking variables. So if you want to link to prescriber, pharmacy, plan, and formulary characteristics files, we have that information added. So as a researcher, when you want the data, you will work with ResDAC to submit your application to CMS. And then we will help you with that. And then once you've decided that once it's all been approved and it's paid for, you will receive the data from CCW. They are the data warehouse and the one who creates the files and delivers all of the files. So ResDAC assists with the request form. Well, you get the data from CCW. So when we think about what we get this claim that's been adjudicated from the pharmacy to the plan. We have that final description of the event. We can't see any prescription that was ordered but not filled. So this isn't a record of all prescriptions. We only see ones that were filled at the pharmacy counter. We also don't see any fill that wasn't paid by the plan. So if someone received manufacturer samples from their physician, or if their drugs were covered by a different entity, the Veterans Administration, for example, or some drugs could be covered by a different part of Medicare. Nate alluded to this, if it's a oral equivalent of a chemotherapy drug, that might be covered by Part B. We'll talk about that a little bit more in a moment. And then that wouldn't show up in the Part D data because the Part D plan isn't responsible for it. And then if it's an excluded drug, generally we don't see it. We will talk a little bit later. There are plans that include Part D excluded drugs on their formularies. And so they'll cover that as a supplemental coverage, but more on that in a few segments, or maybe tomorrow morning, actually. And then we don't get to see all of the claim adjustments between the pharmacy and the plan. We get the final action. And so if a pharmacy submits a claim that the Part D sponsor rejects, that is not included in the Part D event file. Also, any manufacturer rebates or discounts that the drug manufacturer provides directly to the Part D plan sponsor. So when you're looking at the cost of the drug, this is really the cost to the plan or to the beneficiary and the plan. We don't get to see kind of that other piece that's not included in the Part D event file, because this is just a description of what's going on at the pharmacy counter. And then when we look at the drugs paid for by another part of Medicare, if someone is in an inpatient setting, they've been hospitalized, any medication that gets provided to them at that time is covered as part of their hospitalization under Part A. And so we don't see any of that in the Part D event file. And unfortunately, we don't even see that in the Part A inpatient file either, because of the way payments are bundled. They don't line item bill for drugs. So that's just one thing to keep in mind, or if drugs are provided as part of hospice. And then drugs that would typically be administered by a professional are typically covered under Part B. There's a link here that you could look at that kind of gives more information on the types of drugs that those would be. It might even be something that someone does give to themselves at their home, but if it's something that they have to be trained to give to themselves, they're infusing, they've got durable medical equipment that they use at home in order to infuse something, that would probably be covered under Part B rather than Part D. And then we also don't get diagnosis codes in the Part D event file. So this can be tricky because there are some drugs that have multiple indications. So we might not know why a particular individual is taking this particular drug. We can do some things. We can link out to claims data, and that might give us more information. We might be able to get more information on the type of prescriber. But just on the Part D event file itself, no diagnosis codes. And then we don't get to see, this is the fill. We don't really get to see whether the beneficiary uses the drug or how they use it. We may be able to infer some things based on refill patterns, and Gio will be talking about that a little bit later. But we're not following the beneficiary and getting information on whether or not they take the drug. So here are some more resources that you can look at if you're interested in that NCPDP claim. That's what gets submitted by the pharmacy to the plan. The data drug end processing system. So that's when the plan submits to CMS. And then you can see the prescription drug event record layout, which comes to researchers from CMS by way of CCW.